Imagine this: you suddenly feel a sharp, stabbing pain in your lower right abdomen. It gets worse with every hour, and no matter how you sit, lie, or stand, it just won't go away. This could be more than just a stomachache. It might be appendicitis, a medical emergency that often requires surgery. But what exactly is an appendectomy? How is it done? And why is it sometimes the only solution? In this video, we'll break down everything you need to know about appendix removal surgery, step by step, in the simplest way possible. But before we begin, welcome to Global Health Guide, your trusted source for clear, reliable, and easy to understand medical explanations. If you want to stay updated on health tips, medical insights, and treatments explained in plain language, make sure to hit the subscribe button and turn on the notification bell so you never miss an important video. What is appendicitis? The appendix is a tiny, finger-shaped organ located in the lower right side of your abdomen. For most of us, it doesn't play a very big role in our body's daily functions, but the problem begins when the appendix becomes inflamed or infected, a condition known as appendicitis. The pain usually starts near the belly button and then shifts to the lower right abdomen. Symptoms can also include fever, nausea, vomiting, and loss of appetite. The biggest danger of appendicitis is that if the appendix bursts, it can spread infection throughout the abdomen, leading to a life-threatening condition called peritonitis. That's why doctors often recommend quick removal of the appendix before it bursts. And what is an appendectomy? An appendectomy is the surgical removal of the appendix. It is one of the most common emergency surgeries performed worldwide. There are two main methods: open appendectomy and laparoscopic appendectomy. In an open appendectomy, the surgeon makes one larger incision on the right side of the abdomen to remove the appendix. In laparoscopic surgery, which is more modern, several small incisions are made and a tiny camera and instruments are inserted to remove the appendix with less scarring and faster recovery. Small blue diamond: how the surgery is done, step by step. Here's how a typical appendectomy happens. 1. First, the patient is given general anesthesia so they are completely asleep and feel no pain. 2. The surgeon makes either one larger incision, open, or a few small incisions, laparoscopic, in the abdomen. 3. Using surgical tools, the appendix is located and carefully detached from surrounding tissues. 4. Once the appendix is removed, the area is cleaned to prevent infection, and the incision is closed with stitches or staples. The whole procedure usually takes less than an hour, and in many cases, patients are able to go home within 24-48 hours if there are no complications. Why is it needed? An appendectomy is not done unless absolutely necessary. Doctors recommend it mainly when the appendix is inflamed, infected, or at risk of bursting. If not treated in time, a ruptured appendix can release harmful bacteria into the abdomen, making the condition extremely dangerous. That's why doctors usually act quickly, sometimes even without waiting for all test results, if appendicitis is strongly suspected. Risks and recovery: like all surgeries, appendectomy has some risks such as infection, bleeding, or reaction to anesthesia. However, it is generally considered very safe. After surgery, patients may feel some discomfort around the incision, but pain is managed with medication. Full recovery usually takes a few weeks, depending on whether it was open or laparoscopic. Doctors advise avoiding heavy lifting and strenuous activities until healing is complete. Most people can go back to school, work, or normal activities fairly quickly after laparoscopic surgery. So the next time you hear the word appendectomy, you'll know exactly what it means, how it's performed, and why it's sometimes a life-saving surgery. Remember, if you ever experience sudden, sharp abdominal pain, especially in the lower right side, don't ignore it. Seek medical attention immediately. If you found this explanation helpful, don't forget to like this video, share it with friends and family, and subscribe to Global Health Guide for more clear and reliable health information. Together, let's make healthcare knowledge accessible to everyone.